from Nandini Shroff, who is the Director of Applied Research and Project Management at the Institute. We actually did a series of surveys at the Institute on the Institute's efforts to make it a breastfeeding friendly workplace site. And Samantha, Nandini is going to share some of the results of that survey. Nandini, welcome.
Thank you so much, Charmaine, and thank you again for providing this space for me to share those results. I don't have a specific PowerPoint, but I will go ahead and just directly share the results on the screen as I'm talking you guys through them and what we've found. So as Charmaine mentioned, at the Institute for Family Health, we conducted breastfeeding survey among all of our employees in May of 2019 and then again at April 2023. And then we did an assessment of all of our sites as well, and that I'll go into a little bit later. But just in terms of employee responses, our response rate was a little bit lower in 2023 compared to 2019. So we had 334 participants actually respond to the breastfeeding survey. And 77%, which is similar to the 2019 response rate, we're aware that we actually have a lactation policy for our employees. And 7% of those who responded actually either breastfed or pumped breast milk in the last 5 years while they were employed at the organization. And so the results I'll share below are basically based on that subset of patients who responded that they actually breastfed or pumped. The N is much smaller, which is about 25 employees. And so in 2023, one of the big differences I saw were less Latino, Hispanic, or Spanish origin of any race like breastfeeding compared to in 2019. And that might just be, we can't really tell if it's because there are less Hispanic people breastfeeding or just because of the time frame and who actually were pregnant and subsequently was able to breastfeed. But that's like really the biggest change. Otherwise, we see similar numbers across all of the other race and ethnicities. In terms of education, again, a lot less people with bachelor's degree in 2023 who responded compared to 2019, but a lot more people who've had graduate degree or higher, like 59% compared to in 2019 at 32%, but also less people who had associate's degree in 2023, and then high school and below, more people who only had high school below education in 2023. In terms of region, it was pretty even in terms of the breakout of people who fit into this bucket at our Mid-Hudson sites compared to our New York City sites. One of the biggest one that I saw that changed was in 2023, 61% actually continued to breastfeed or pump for 3 months or more upon returning to work. And part of me also wonders how much of that was due to the impact of the pandemic, where certain departments at the Institute also went remote. So it was a lot easier to be able to continue to breastfeed or pump for a longer period of time versus when they came back in 2019. And same thing in 2023, 87% said they were allowed adequate time to pump during work hours. And I wonder how much of that was because of the impact of the pandemic and sort of the working conditions of some of our departments at the Institute. I know I definitely fell into that bucket where I was pumping at home in 2023 compared to my prior pregnancy. The other big difference was in knowledge in terms of like the fact that employees were aware that they had specific rooms for breastfeeding or pumping that could be accessed at any time. The numbers were very similar between 2019 and 2023, but there were definitely more people in 2023 who knew that there was a place where they can store breast milk and pumping equipment at work than in 2019. In 2023, it's really interesting. So 77% felt supported, which is more than in 2019, to breastfeed or pump at work. And then less percent of people also felt embarrassed to ask for time to pump or be judged negatively compared to in 2019, which was 35%. So we're doing a little bit better in those areas for sure. And then in 2023, about 30% of all respondents estimated like that we needed to improve our policies around breastfeeding, and 61% said that we still needed to do a better job about like policies and benefits that are related to childcare on site or nearby. So I feel like childcare has been such a big issue just across the board for a lot of organizations. So areas for improvement. Some of the areas that came up was basically like having a clean space to actually breastfeed, and then having privacy in order to breastfeed, and then having just having like space or like sink to wash their pumps and bottles and all of that stuff too. Things are improving for the most part between the 2019 numbers and the 2023, but we can certainly do better in those areas. We can continue to do better in those areas. And then I'm going to switch gears and talk about lactation space assessment. And this is where we basically sent out these surveys to all of our practice administrators across all of our sites to really have them assess like their lactation space that they provide for their staff on site. And so one of the biggest changes that happened between 2019 and 2023 is that in 2023, we also reached out to our program staff at our homeless site. So some of the data is a little bit skewed because of that. So just keep that in mind. So the response rate was great. Everyone responded to how their facilities were managing the lactation space area. In terms of the dedicated space type, we do see an improvement in 2023 where now more people are actually offering more private spaces where they can lock or like close the door and actually have private space to pump. And so in 2023, we see 17 locations offered an office compared to 4 in 2019, and then 9 locations offered a conference room compared to 2019, which is only 2. We still have 1 location that is still using their break room as a space, which I know is not ideal for a lot of breast pumping moms. Milk. And then these spaces are not, I just want to make sure that there can be like sites who said like, we do have an exam room plus an office if there are multiple staff people who need to use the space, that they do have multiple things that they might have checked off when they responded to this question. In terms of refrigeration capacity, again, I think this is one of the places where we can certainly improve on. It's similar to 2019 where 75% of all locations had a refrigerator where employees could actually store pumped milk compared to 77% in 2023. In 2019, it was 4 sites who did not actually indicate whether or not they had refrigerator compared to 1. So we had a better response rate here. And then in 2019, this is where we do see an increase where 1 site said they did not have a refrigerator where employees could store pumped milk compared to 5 sites. And this big jump is basically because we've included our healthcare for the homeless programs. Those programs are really small, and they don't have the space within the larger homeless centers that they're providing healthcare in. So that's one of the reasons why we see an increase, but there's obviously room for improvement there, and we can try and figure out ways to sort of address that issue. So I think those are probably the biggest findings from our own assessment at the Institute for Family Health. It's been really interesting. It's reassuring to see improvements between 2019 and 2023. And I think we need to continue to train staff and employees and make sure that they're aware of the resources we have available on site and sort of the rights around this as well. So I think we can continue to do a lot more work in this area.
Thank you, Nandini. Much food for thought, especially for those of us at the Institute wanting to make sure that what we're advocating and working on externally, we're also advocating and working on internally in our own organization. So yeah, you know, we need to be fully transparent as we talk to our friends and our partners and our collaborators. And it also gives us a unique perspective and understanding how challenging organizations may find it. So they hear from us that we are also challenged by it, and we're trying to figure out how to address it with some of the key folks that can make the decisions that make us more breastfeeding friendly for all employees who need it. So again, thank you, Nandini.